Hi everyone, welcome to OIT 369. We are back with another role play card. I hope you're all really doing well. So my name is Asha.
My name is Dia.
So today what we are doing is ഇന്നത്തെ നമ്മളുടെ റോൾ പ്ലേ കാർഡിൽ നമ്മൾ കോളിസിസ്റ്റക്ടമി അതായത് ഗോൾ ബ്ലാഡർ റിമൂവലിനുള്ള ഒരു പേഷ്യന്റിനെയാണ് കാണാൻ പോകുന്നത്. സോ ഈ പേഷ്യന്റിന് ഗോൾ ബ്ലാഡർ റിമൂവ് ചെയ്യുന്നതിനെ കുറിച്ച് ലിറ്റിൽ ബിറ്റ് ആങ്ഷ്യസ് ആണ്. അപ്പോൾ ആ പേഷ്യന്റ് നഴ്സിനെ കാണാൻ റിക്വസ്റ്റ് ചെയ്തിരിക്കുകയാണ് to know more about the surgery and then to decide whether she should have it or not. Okay, so shall we start?
Yes.
Okay, so I will be acting as a nurse and Dia will be acting as a patient for us. Okay, good morning.
Good morning.
Hi, nice to see you. How may I help you today?
Hi. I've just come in for a gallbladder removal. I'm feeling a bit nervous about it. Do I really need it, or I've never really had surgery before. I've never really gone under anesthetics.
Yeah.
So I'm not sure what to expect.
All right. It's very natural for you to have such kind of feelings, especially when you haven't had a surgery before. That's quite understandable. But to explore more, may I know what makes you so anxious or nervousness about the surgery?
It's just I've never had a surgery before.
Okay.
I don't know if I really need to have it.
Okay.
I've never had anesthetics
Okay.
done before. I've not even really been in hospital before, so I'm unsure.
I know. So it's quite hard for you to get it in the first instance. I completely agree with you.
Yeah.
But what I will do is I can tell you that when you hear the term anesthesia, especially general anesthesia, it may sound a bit complicated.
Yeah.
But let me tell you, this is managed by a specialist doctor who is specialist, like we call them anesthetic. So there will be an anesthetic from the procedure, throughout the procedure, like from the previous day until you finish the procedure. So there will be a specialist doctor with you for that, and you don't have to worry because there will be a team of nurses and doctors looking after you. And it's quite common these days to have these general anesthetics, so the system is very advanced, and there won't be much complications as we used to have years ago. So you can be reassured about having an anesthetic. That should be fine for you. Okay. And about gallbladder operation, it's very common these days. Many people have this problem these days, so we are getting into that routine of having this gallbladder operations. It's a very small surgery. We do it as only as a keyhole surgery. So it doesn't actually involving opening of any area. It's like a keyhole opening. So you don't have to worry too much about it, I would say.
Okay.
All right. And your recovery time is going to be very short. So don't worry too much like I have to stay in bed or I have to be like a post-surgery patient for months. That's not the case.
Okay.
It will be like within a week you should be fine and you'll be back to normal.
Okay.
How do you feel about that now?
I do feel a bit better, yes.
Yeah.
How long would recovery be?
It's probably going to be 1 to 2 weeks, but not more than 3 weeks, I would say.
Okay, so will I get to go home? Do I have to stay in hospital for those weeks?
No, you don't have to. You will be discharged like within 48 hours if everything is okay.
Okay, that sounds good. Yeah.
Okay. Okay. So do you have anything else to ask?
No, not really. You've answered most of my questions.
Okay. Do you know why you're undergoing this operation?
Not really. I don't really know if it's necessary, if I really need to have it at all.
Okay, so basically, because you've got diagnosis of chronic cholecystitis, it is very hard to manage it without surgery, basically. And we know we have tried antibiotics, we've tried everything else. So your gallbladder is still getting infected, and the only solution now is to remove it. Okay, but as I said, it doesn't worry because it may reoccur, and you may have to end up coming back to hospital, which is not very nice, is it? So that's the reason, and it is very necessary to have, and your digestion should be all right.
Okay.
So those things has to be considered, and that's why you're having this operation. So I would recommend you to go for this. All right.
Okay. Will I have any side effects? Anything like that
You may have slight side effects like pain.
Okay.
As usual, all the surgery, but we can always manage that with analgesia.
Yeah.
You may have some discharges, and you may need a little bit of assistance during the first day of operation. So I would like to check, is there anyone to escort home after the surgery from the hospital?
Yes, my brother will be taking me home.
Okay, and will he be happy to stay with you overnight as well, just in case?
Yes, I'll be
He will be. All right, that's fine. Do you know anything about the pre-operative preparation that you may have to go for before the surgery?
Not really.
Okay.
I've just been asked for consent, that's it.
Okay, so I will just explain some requirements. So you should be fasting 6 hours before the surgery. So you've scheduled it for like tomorrow morning, so you'll be fasting from tonight basically.
Okay.
And you know, we will remove any nail varnish, and we will share, you know, we can have a shower before the operation. So that's the only pre-operative procedures you made it, nothing much, you know.
Okay.
It's all the basic things.
So can I have water? Is it
Um,
complete fasting?
It is complete fasting because it's a abdominal surgery.
Okay.
And you know, there is nothing else you have to worry. As I said, there can be slight side effects like bloating, some discharges, some pain, but other than that you should be okay.
Okay.
How do you feel altogether?
Yes, that's reassured me a lot. That sounds
Great, I'm
better.
glad to hear that. Thank you so much, and I hope you will get well soon after the surgery,
Thank you.
and we'll all be with you throughout the surgery.
Okay.
And if there is anything, as I said, there is a team of specialist doctors and nurses here to assist you as well.
Okay.
We are
Sounds
here
good.
with you. All
Okay.
right, you're
Thank
not
you so
alone.
much.
Okay, so thank you.
Thank you.
ഓക്കെ, സോ ഈ പ്രൊസീജിയറിൽ അല്ല, ഈ ഒരു റോൾ പ്ലേയിൽ നമ്മൾ കണ്ടു പേഷ്യന്റ് അത്ര ഒരു കോപ്പറേറ്റീവ് പേഷ്യന്റ് ആയിരുന്നില്ല അല്ലെ. അപ്പൊ നിങ്ങളുടെ ഇന്റർലൊക്യൂട്ടർ അപ്പുറത്ത് ഇരിക്കുമ്പോൾ ചിലപ്പോൾ എല്ലാ പോയിന്റും നിങ്ങൾക്ക് നിങ്ങൾ ഇട്ട് തരണം എന്നില്ല. അപ്പൊ നമ്മൾ ആസ് എ കാൻഡിഡേറ്റ് എന്താണ് നോക്കേണ്ടത്? നമ്മൾ ആ റോൾ പ്ലേയിലേക്ക്, ആ പോയിന്റ്സിലേക്ക് നോക്കിയിട്ട് ഇന്റർലൊക്യൂട്ടറിനെ അങ്ങോട്ടേക്ക് കൊണ്ടുവരണം. ഇപ്പൊ ഇവിടെ ഇന്റർലൊക്യൂട്ടർ പ്രീ ഓപ്പറേറ്റീവ് കാര്യങ്ങളെ കുറിച്ച് നമ്മളോട് ചോദിച്ചിട്ടില്ല. അത് ഇന്റർലൊക്യൂട്ടർ ചോദിച്ചില്ലല്ലോ എന്നാൽ ഞാൻ ചോദിക്കാണ്ട് പോവാം എന്ന് ഓർത്തു കഴിഞ്ഞാൽ you may miss the marks. അപ്പോൾ നമ്മൾ എപ്പോഴും ഇന്റർലൊക്യൂട്ടറിനെ ആ പോയിന്റിലേക്ക് കൊണ്ടുവന്ന് you have to ask them even if they haven't asked you. So that's the tip I have to give here on this day. എപ്പോഴും നമ്മൾ ടൈം മാനേജ്മെന്റ് ശ്രദ്ധിക്കുക. So I hope we were able to help you today. We'll be back with another role play card. In the meantime, if you have any online course inquiries, please do not hesitate to WhatsApp in the given number, and we'll be back with more exam role play orientated role play cards soon. Thank you so much, and continue to support us please. Thank you and bye.